Across the country, it's a number health professionals want to see reversed. Cases of syphilis have increased, and there is a big push to stop it. So, how bad are we talking? Well, according to a report from the CDC released in January, 207,255 total cases were reported in the U.S. in 2022. That's an 80% increase since 2018, and it continues a decades-long trend upward.
Syphilis is one of the oldest diseases.
I spoke with Dr. Elizabeth Cuervo Tilson, the state health director and chief medical officer, and Dr. Victoria Mobley, the HIV/STI medical director for North Carolina.
But over the past decade, and then specifically over the past 5 years, it has really been surging.
Like the CDC, they tell me cases in nearly every demographic group and region have increased here as well.
And also what we're seeing is a surge in women. And then when women get syphilis, then it can also get passed on to the babies. So what we are seeing, especially this year, is very much a rise in what we call congenital syphilis, or babies getting infected while their moms are pregnant. So this is a big deal.
But what has changed? Why are those numbers going up?
Prior to the last 5 years or so, we mainly saw syphilis reported in specific populations, in particular in populations of men who have sex with other men. That epidemiology has changed in the last 5 years, and we're seeing the fastest growing reported syphilis cases in women, particularly women of reproductive age and their male partners.
And though there are some symptoms, you can't always rely on that as an indicator.
So there are symptoms. And it could be as subtle as a sore, which oftentimes is painless and maybe in a location that you aren't able to typically observe, so you might miss it. A rash, hair loss. There's a slew of symptoms because syphilis can really affect almost any organ system. But I will say that most pregnant women diagnosed with syphilis are asymptomatic, so they have no symptoms at the time they're diagnosed. So you can't just use symptoms.
So the health department has launched an aggressive plan to expand access to treatment from now through June. They are increasing screening for pregnant women using rapid tests for both syphilis and HIV.
Digital campaign, and we have gotten an amazing amount of hits and traction and awareness, especially in that digital campaign which launched earlier. So a lot of traction there.
They're also providing educational material and posters to help cut down on those numbers and try to turn things around. Rod Carter, CBS 17 News.